Hello, how are you today? I'm great, thank you for asking. I'm Dr. May. I'm sure we've met before. I'm gonna be the one doing your physical exam today, and it was just a regular checkup. You didn't have any concerns you wanted to ask about or anything? Okay, wonderful. So I'm just gonna confirm some information here. So can you just confirm your last name for me? Perfect. And what's your date of birth, hon? Perfect. Alright, and your height? Okay. And what's your weight, if you're comfortable, of course? Great, perfect. And what's the best way to get a hold of you? Phone number, email? Okay, what's the number? Perfect, thank you so much. And are you on any medication at all? And what's that for? Okay. How long have you been on that? Okay, thank you. And do you have any family history that I should know about? Like diabetes, high blood pressure, things like that? Not that you know of? Okay. Okay, great. And the last thing is, have you had any surgeries at all that isn't in your chart? Okay, perfect. That's everything. So I'm just gonna put on my gloves here. And you're okay if I'm poking and prodding around? Shouldn't hurt at all. But of course, if there's any pain, let me know. Great. So I'm just gonna check some of your vitals first. I'm gonna start off with your heart rate and your lungs. So I'll start with your heart first. I'm just gonna put my stethoscope in here. Okay, and just relax there. And I'm just gonna be looking at the clock here. Okay, and then take a nice deep breath in for me and out. Great, great. Another nice deep breath in for me and out. And right here, a nice deep breath in. One more right here. Deep breath in and out. Perfect. Okay, and then I'm just going to listen to your bowel movements here. Okay. Okay. Perfect. That all sounds great to me. So let me just check your temperature here. So I'm just going to be placing this under your tongue. If you could just open wide and close your mouth. And we're just going to be, let me just see if I can even press the button. There we go. It only takes a few seconds to read. Okay, perfect. Put this down here. Okay. So now I'm just going to start at the top and kind of work my way down. So I'm just going to take I'll look at your scalp and hairline first. Just checking for any suspicious moles or just the overall health of your skin on your scalp. So, okay, that looks good. A little bit of dander, but nothing serious. And I'm just gonna check your hair health here. Okay, now I'm just gonna feel your lymph nodes here and just relax. And your sinuses. Good, you're doing great. Okay, and I'm just gonna feel your face for any lumps, bumps, things like that. Okay, perfect. Okay. Good. Any pain or discomfort when I'm doing that? Okay, and I'm just gonna feel the orbital bone. Let me just feel your ear here. Good. And then around this side. Perfect. Okay. Great. Right, and just checking your eyes. I'm just gonna take this off actually. Okay. I'm going to check your eyes. Perfect. Pupils are reacting great. Okay. And I'm just gonna cover one nostril here. Can you take a deep breath in through your nose? Good. And then this side here, same thing. Deep breath in through your nose. Perfect. No obstruction to the airway. And then I'm just gonna get you to go and stick out your tongue. I'm gonna be placing this on your tongue there. And then I'm just gonna go in with my light. Mouth looks great. Gums look very healthy. Okay, good, good. Perfect. Back of the throat looks good. Okay, and can you smile real big showing your teeth? Perfect. Okay, can you blow out your cheeks for me? No problem. And then I'm gonna get you to open your mouth and clench. Open your mouth and clench. Perfect. And then can you close your eyes super tight and don't let me open them. Perfect. Alright, feel free to open those. Alright, so that all looks good there. Next, I'm just going to be measuring your facial features, just checking for symmetry. So I'm just gonna start over here, and that's one. And right here. Good. Last one right here. Good. Perfect. And can you just tell me with your eyes closed if I'm touching you with the soft side here or the sharp? Okay, so close your eyes and I'll begin. Just gonna be doing your face. Soft, yep. And sharp again. Soft. Sharp. And soft. Perfect. Feel free to open your eyes there. So now I'm just gonna be moving on to your body. And I'm just gently gonna feel along your body. Again, let me know if there's any pain or discomfort while I'm doing this. I'm just feeling for any lumps, bumps, anything that's not supposed to be there. Also taking a look at your skin for any mold, rashes, things like that. Collarbone back here. Okay, down the shoulder. This side, down the shoulder. Good. Okay, just checking this side here. And I'll go around this side here. Any pain or discomfort while I'm doing these palpations? Or percussing, I should say. Okay. I'm just gonna palpate a little bit deep into your stomach, just feeling kidneys here. Side over here. Down your legs. Okay, I'm going to go to the bottom of your feet and I just want you to push your feet against my hands there. Good. And then don't let me pull them towards me. Good. Perfect. Okay, so now I'm just going to go in with my reflex tool here, and I'm going to start with your elbows, so just relax. Good, this side. Good, and then your wrists, just relax. Good, and then your knees. Good, and your ankles. Is perfect there. And can you keep your arms at your side? Don't let me pull them out. Same on this one. Okay, now I want you to try pulling them out, and I'm going to try and keep them pushed in there. Good. Now try to raise your legs. Good. Okay. I'm just going to feel under your armpits here. want you to close your eyes, and the same nerve test that we did on your face, we're going to do along your body. So I want you to tell me with your eyes closed if you feel the soft or the sharp. Okay, close your eyes and we'll begin. Soft, sharp, soft, soft, sharp, sharp, soft, sharp, soft, sharp, and soft. Perfect. That's wonderful there. Alright, so the last thing that I want to do is I'm just going to measure your limbs, make sure that everything is symmetrical there. So just keep them nice and straight. This side over here. Okay. And then your legs here. And this side over here. Great. And your hips are nice and straight. And your chest here. Let me just get your feet. Okay. Perfect. I am just going to write this down in my notes. Don't worry, there's nothing concerning. I'm just writing what we did and how well it turned out. Perfect. Did you have any questions at all? Alright then, you are free to go. Thank you for trusting me, and I'll see you again next time. Bye-bye. Bye-bye.